Hello everyone, it's the Herb Girl here. And this video is all about the books that you will need to set yourself up on a solid foundation in studying and practicing clinical Western herbalism, most specifically for people studying for their naturopathic licensing examination. So before we get started, a few things. This video is for learning purposes only. And if you do want to implement a botanical medicine regime in your life, please contact your naturopathic doctor or your herbalist. And if you don't have naturopathic medicine license in your state, please reach out to the American Association of Naturopathic Physicians. They have a website, they have an advocacy page, and you can find out more of how to be proactive in getting naturopathic medicine license in your state. Okay. Second, I am a fourth-year naturopathic medical student, so I have not taken the clinical naturopathic licensing exam yet. However, I did coordinate with the doctor who teaches our Materia Medica at the school that I attend, and we feel like these are the books that are best suited for people who are going into entry-level naturopathic medicine. And this video is focusing more on the Materia Medica and not so much on the formulation. Formulations, I'll do a whole series on that later. So let's get started. The Materia Medica for the naturopathic licensing exam is around about 200 herbs, and you need to know a few things about each herb. So we want to know our indications, we want to know our contraindications, we want to know our actions, our adverse reactions, and then we also want to know the pharmacognosy. Now I am going to explain these, the definitions of these in more detail, because as a TA, I noticed that sometimes students get use these terms interchangeably, and they're not really the same thing. Most specifically, the difference between what an indication is and what an action is. So an indication is what herb would be good for what condition. For example, Verbascum thapus or mullein is indicated for the condition of asthma. It has an affinity for the lungs, and action is what the herb actually does when it gets to the tissue. So Verbascum thapus is going to get to the lungs, and it's going to act as an antispasmodic, it's going to act as a demulcent, and it's going to act as an anti-inflammatory, just as a few of the actions of this herb. So that's the difference between indication and action. An action is what the herb does when it gets to the tissue, and an indication means that it's effective in treating a specific condition. I hope that makes things a little more clear. So we just went over our indications, and we just went over what actions mean. So now, what is a contraindication? A contraindication means that this herb is not indicated for this condition, meaning this herb should not be used for this specific condition. An example of that would be using artemisias in pregnancy. Most artemisias, like Artemisia douglasiana, Artemisia annua, Artemisia absinthium, these herbs cause uterine contractions, which you don't want to use in a pregnant woman, because can cause contractions, and that would be an abortive fashion possibly. So that is what a contraindication is. And next we have adverse reactions. Adverse reactions are simply the side effects from the plant. For example, Baptisia tinctoria can cause GI upset, nausea, and vomiting. So that's a side effect of taking this plant. And last but not least, we have pharmacognosy. Pharmacognosy is the biochemistry of the plant, and it's also the reductionist way of looking at a plant and taking that one primary constituent and looking at what it does and using that for treatment. So pharmacognosy, we need to know it. We need to know biochemistry. We are working clinically with people. We're treating some legit illnesses. So we need to know that information as a naturopathic doctor. And then the looking at the separate constituents, that helps our field because of the way that the scientific community works and how it's evidence-based and how they use that evidence to usually focus on that one prime constituent. So we need to know that too. So that's a good thing, and it's a bad thing in a way, because as naturopathic doctors, we know that it's so much more than that one active constituent. Those secondary metabolites and that whole plant medicine, that is the crux in treating a whole person. So with all of this being said, what are the best sources for us to use outside of the classroom and outside of the PowerPoints in being able to build ourselves up in the knowledge of the Materia Medica? Because it is a lot of information. It's a lot of plants. So the first book, and where I attend school, this book is required in our Materia Medica class. I say if you are practicing clinical Western herbalism as a naturopathic doctor, I think you should get this book. It's Medical Herbalism, the Science and let me have to look at it. The Science and Practice of Herbal Medicine, and it is by David Hoffman. This book it's your foundation, has the foundational knowledge of phytochemistry or pharmacognosy, and it tells you about the main active secondary metabolites such as polyphenols or alkaloids, things like that. And then it's split up into two parts. So that's the first part. And the second part goes into the organ systems of the body and how you would look at the organ system in terms of treating with botanical medicine. And then it goes through and it gives like different type of formulations for the organ system. And it does break it down into different conditions of the organ system. And the back of the book is a tiny Materia Medica with some of the plants that are on the list for NPLEX exam. So this book is a must-get, I'd say, if you are going to practice clinical Western herbalism and naturopathic medicine. You can always refer back to it. And it's my go-to right now when I'm working in the clinic and I'm treating patients, and this is my first time working with a condition. I go there first. The next book that I say is a must-get is the Phytochemistry and Pharmacy for Practitioners of Botanical Medicine. And this book is by Dr. Yarnell. This is the pharmacognosy textbook, I say, for us. If at this point in your naturopathic career, well, especially if you're third year or beyond, your knowledge in biochemistry should be pretty solid. So this book should be easy for you to read. If you cannot read this book at all, you're either not studying naturopathic medicine, which that's totally fine. You should reach out to get treatment. Or if you're reading this book and you are studying naturopathic medicine, you need to take a step back and really nail down your biochemistry because we're working with people's lives and we need to hold ourselves accountable and we need to make sure that we're educated. But this book here goes into the secondary metabolites of the plants a little more. There's so much information in this book. I could spend a whole video actually talking about it. Another good thing about this book is that it also talks about solubility. And this book is helpful when you're creating formulations, how to be able to make the herbal actions that you want from the plant, make them more bioavailable in the body, which is just makes for a more effective treatment altogether. So I'd say if you had to get two books and only two books, it would be the Phytochemistry book by Dr. Yarnell and the Medical Herbalism book by David Hoffman. But moving on, you know, we have this Materia Medica, and we have to go beyond our PowerPoints that we get in class, because each herb just does so many different things. So I reach out and I found a really great book or books that have a Materia Medica, and it covers majority of the plants that we are studying. And this book is by Matthew Woods. It's the Earthwise Herbal, and it comes in 2 volumes. We have volume 1 here, and volume 1 is the Old World medicinal plants, and then we have volume 2 here, which is the New World medicinal plants. This book is just full of monographs, herb after herb. It talks about it. And what's great about Matthew Woods is he really goes into tissue states and looking at the constitution of a person, which is also something vital that we need to know when treating in naturopathic medicine. And it's not something that from what I'm seeing as I'm studying for the NPLEX 2 exam, that's not something that you're really tested on, but it is something that when you are formulating and you are treatment, you don't want to give a hot person a hot plant when a cool plant could be indicated for the same condition and help bring their body down, bring their body back into homeostasis. So if you are looking for just Materia Medica, the Earthwise Herbal by Matthew Woods, these are the books that I highly recommend. Now there is another book that's really good that has Materia Medica in it. And then also it's split up into 2 parts. The front part is Materia Medica, and the back part is actually formulations. And she gives you a lot of formulas in here. And this is by Dr. Sharon Tilgner. And this is the Medicine from the Heart of the Earth. This is a good book. And I like the way that her Materia Medica is set up, because it's super easy to read, super easy to understand. And for me, it's really good if I just want to know like the action of a plant or the indication. I can go through here and find it pretty easily. So this is another book that I recommend. So when it comes to just a solid foundation and being able to have references on hand when you're treating, those are the books that I would say are best. If you just want to have that foundation and you don't really want to explore more into botanical medicine, then like I said, the first 2 books by Dr. Yarnell and David Hoffman will be your go-to. Now, if you're like me and you also want to become a registered herbalist and you're practicing that, you want to expand out a little bit more, I have some other books that I can offer you as a reference. And first are for those, I think native plant medicine is really important, because knowing the medicinal plants in the area that you're located is, well, number one, it's great because you can go outside and get yourself some medicine. But also too, it helps you, I feel like for me, it helps me connect to the ancestors of the land and the Native Americans that were here before, and learning how they use these medicines to treat is actually very powerful, and it's more of an intuitive way of treating. And not only that, but you're learning the medicine that you're around, and you're communing with the earth. So native plant medicine is just a beautiful thing. And Michael Moore is a herbalist and author who he has so many books. So I'm in Southern California, so I have his book on medicinal plants of the desert and canyon west, and these are just monographs, but it's monographs of the plants specific to this region. And then also too, medicinal plants of the mountain west. I have this as well. And again, it's just monographs of plants that are specific to this region. And these also have some of the plants from the Materia Medica on it. So you get to read, he has research in his books, and you also get to read the native uses of the plant, which they coincide with what we learn, but sometimes you just learn some extra things. If you are in the northwest region of the United States, He does have medicinal plants of the Pacific Northwest. So if you're in that region, I would recommend that book by Michael Woods as well. And I'm looking through my pile of books here for you. If there's also another book, if you're interested in pharmacognosy, that is by Bill Mitchell. It's Applications of Botanical Remedies and Naturopathic Medicine. And this book is just all about the different constituents. I'll just hold that here for you so you can kind of see. So it goes through, so this page says bitters, and then it has Achillea millifolia, which is yarrow, and then it tells you the two main active constituents in it, which that works well if you really want to go evidence-based. You can find this constituent and then plug that constituent into the PubMed database and see what research is on it. And then we also have cases, naturopathic medicine cases. So for the book that I just showed you, in the pharmacognosy book by Bill Mitchell, and for this other book here by Bill Mitchell, you can possibly get it at your naturopathic medicine school bookstore. And this book just gives you clinical cases, and then it tells you the botanical medicine treatment, and some of them have follow-up cases in it. So this is just a way for you to read how botanical medicine is used in the clinical setting. So this is another good reference for you. And then one last reference that I am offering is the Earthwise herbal repertory by Matthew Wood. I have a lot of Matthew Wood books, as you can see, because he's great. And once again, this book really touches on the tissue states and the body. And I really think that that's the main reason why I think I have this book, is because it just helps me really have a strong foundation of if I'm looking at something that's depressed and sluggish and congested, or I'm looking at something that's overstimulated and hot. So that's what this book does, but it's kind of split up into, it gives you a condition, like I just opened the book, canker sores, and then it just gives you a bunch of herbs that are indicated for canker sores. So this is a quick reference if you just want to like see an herb. So it tells you the herb, and then it tells you the action. So you have Althea, it's a mucilage. So you can use that as a quick reference for a specific condition. So that is all I have for references or book references and setting yourself up for a solid foundation and practicing clinical Western herbalism as a naturopathic doctor. And I didn't mention this at the beginning of the video, but I am saying naturopathic doctor and not naturopathic physician, because I am in the state of California, and in the state of California, you can't say naturopathic physician. So that's why I say doctor. I believe that's it. So we have our Materia Medica, we have our book by David Hoffman, we have our book by David Yarnell. Those are foundational. And then we have the books by Michael Woods and Michael Moore, which are just books of monographs, native plant medicine, and old world and new world medicine. And then we also have the book by David Mitchell, which goes into the different plant actions and the different plants and the constituents that have those specific actions, very detailed, as well as his book of case histories and using botanical medicine treatment in the clinical setting and the outcomes of those treatments. That is all. I wish all of you well. I hope that this video helps you in some way in becoming a competent naturopathic doctor using herbal medicine, and I will see you all soon for future videos.